My name is Tomas Kalincik. I'm a neurologist and a researcher at the Royal Melbourne Hospital and the University of Melbourne. Today we are living in an exciting era where for almost any clinical decision that we take, there is data to support that decision. And it's thanks to the patients, people with neurological conditions who help neurologists collect relevant information that can be used to generate this data and this evidence. One should keep in mind that collecting data is not the whole story. There is an important further step. There is actually a long journey before data can be translated into evidence, and that requires a lot of expertise, a lot of analytics, and a lot of time and effort. In multiple sclerosis in particular, we've been active in this area. We have shown how observational data sets can be used to create clinically meaningful and useful information that can then benefit patients and their treating physicians. So specifically in MS-BASE, a large observational international cohort, we have utilized this power of data to create evidence about treatment starts, when to stop therapy, how people respond to different types of treatments in different situations, how pregnancy influences outcomes in multiple sclerosis, information about epidemiology of multiple sclerosis, and so forth and so forth. In Melbourne Brain Centre, we are in a privileged position where there is not only the multiple sclerosis team, but there's a number of high quality teams, a number of leaders in their specific areas, teams such as epilepsy, stroke, movement disorders, dementia, that work closely together in their areas of interest and expertise. One thing that is common for all these teams and all these efforts is that the moment that they obtain access to data, when they generate observational data sets, they require the expertise and skills to translate that information into evidence that will then benefit the patient. So for that purpose, to bridge that gap between data and evidence, we've recently launched a unit called Clinical Outcomes Research Unit, whose purpose is to work as a translator between the two tribes that speak two very different languages, and they are the tribe of analysts and the tribe of clinicians. So we are there in the middle, bringing what we observe in real life to what can be done for people with various diseases in the future. And very shortly we will start engaging in work not only in multiple sclerosis, but on problems in epilepsy, in stroke, in dementia, in movement disorders, and so forth, other areas in neurology. Clinical Outcomes Research Unit is a young team, is a dynamic team, and it is a growing team. And it is a team consisting of analysts and neurologists. And if this vision appeals to you, you can go online and find out more about what the core is. And if you're interested, maybe you can become one of the core.